Rosie here from rosiepena.com. Welcome back to my channel. So in today's video, I'm going to talk all about OR nursing. So OR stands for operating room, and nursing, of course, you know what nurses do, but things are a lot different in the operating room compared to other types of nursing. So med-surg nursing, they're typically at the bedside giving medications to the patient, and ICU is basically like med-surg but a little bit more advanced, a lot more critical patients. You're going to have a lot more medications that you're giving them, and you're going to have less of a nurse to patient ratio. So on a med-surg floor, you're going to have about 6 patients, and then on an ICU floor, the most you'll probably have is 2 patients. Of course, there are other types of nursing as well. So NICU stands for neonatal intensive care unit. Those are going to be taking care of little babies, so premature little babies, even as low as like 1 to 2 pound babies. Then you have your mother baby nurses, which are taking care of the mother and the baby after delivery of the baby. Also, you'll have labor and delivery nurses, which are helping the doctors deliver actual babies. As you can see just from these few examples, there are so many different types of nurses out there. And I think one of the main reasons why I chose the operating room is because I was actually born by C-section. So I was in an operating room literally at birth. My mom had a C-section with me, so born in a sterile environment. I was born in an operating room. For some reason, the operating room has just always interested me. I love the structure of the operating room. There are steps that you need to take. You have to be strict, you have to be sterile, and there's of course a lot of organization. Not to say that there's not organization in other types of nursing, but like I said, for some reason the operating room has just always interested me. And to be honest, you don't need some big reason to become an operating room nurse. It could just be something that you want to try out. Those are a few of my reasons for choosing the operating room. I know there are some other people that had some really great experiences through their nursing clinical rotations. They were actually able to like do something as cool as like feel a beating heart while they were scrubbed into their clinical rotation in the operating room. Once you're in nursing school, you'll see all different types of nursing through your clinical experience. So you'll probably visit a mental health clinic to see what the nurses do who take care of psychiatric patients. You may even see like an emergency room nurse. You'll probably go to labor and delivery, possibly even the NICU. And then a few people also get the chance to see the operating room. I actually, in my nursing clinical rotation, did not get to see the operating room at all. But like I said, I just knew that the OR was somewhere where I wanted to be. So that was actually the only nursing position that I applied for, and I got the first position that I was offered. So if you're watching this video, you're probably curious just to know a little bit more about the operating room. It might be an option for you, or you may have always been interested in the operating room. So I am currently an operating room nurse. I've actually just passed my 1-year mark. So I've been in the operating room for 1 full year. So I definitely have a good idea of what it takes to be an operating room nurse. Now there's definitely a lot more experience that I need before I'm, super advanced in my career, but I think 1 year is a good amount of time to be able to tell you guys what exactly an operating room nurse does. So I think a big misconception about the operating room as far as nursing goes is that you are going to be right there with the surgeon, scrubbed into the procedure, and you're going to be sterile and you're going to be helping them with the procedure. And while there are operating room nurses that do this, one of the main roles of operating room nurse is going to be your circulating nurse. So a circulating nurse, what I do, they're actually outside of the sterile environment. So they're not scrubbed in with the surgeon. The people that are usually scrubbed in with the surgeon are actually called scrub techs, or CSTs, which stands for certified scrub tech. So the scrub techs are the ones that are actually right there with the surgeon, handing them the instruments, opening up the sterile supplies, getting the sterile field prepared. And a circulating nurse or an operating room nurse is going to be outside of the sterile environment. The circulating nurse is responsible for setting up the operating room for the specific procedure that is going to be performed. So depending on the surgery, there's going to be different positioning tools. There's going to be different ways that the OR bed needs to be positioned in the room. There's of course going to be different supplies that you have to have, different machines that you're going to have to get into the room as well. And depending on what side that the procedure is going to be performed on is going to depend on what side that you put all of this equipment. So before going into the operating room, I actually had no idea how physical this job is. Some of the stuff is pretty heavy. If you don't like manual physical labor, definitely don't go into the operating room. So that is one of the common misconceptions about operating room nurses. You will think that they're the ones that are right there with the surgeon. While a circulating nurse can transition from a scrub nurse role that is scrubbed in with a surgeon to a circulating role that is outside of the sterile field, I would say the most common role of an OR nurse would be the circulating role. But you do also have the scrub nurse role, which is exactly like a scrub tech role. sterile. Okay, so to walk you through what a circulating nurse does, I'll just walk you through a typical day of my job, a typical day of what I do at work. So as you know, in the operating room, there are surgeries being performed. Of course, the main idea is to keep everything nice and sterile in the operating room. While everything in the OR is not sterile except the sterile field and then the scrubbed in surgeon and scrubbed in scrub tech, and of course all of the surgical supplies and equipment that are within the sterile field. If you're outside of that OR sterile field, so in the operating room but outside of the sterile field, none of that is actually sterile. Of course, we want to maintain as much sterility as possible, so one of the ways that we will do that is to keep the operating room area closed off to the other parts of the hospital. So in order to get into the operating room area, of course you're going to need a badge to get badged in. These doors are not just going to open for anyone in the hospital. You're going to have a scrub cap on, which is going to keep all of your hair wrapped up, so similar to like a hairnet that a person who handles food would wear on their head. We're going to wear that as well. So you have to have a scrub cap, and then of course we're not going to wear just our regular clothes into the operating room environment. We're going to wear the scrubs that are provided by our hospital, which are sterilized and then provided to us every day to get into the operating room. So when I go to work, I can actually just wear like regular clothes. I can wear leggings, I could wear a t-shirt and jeans, whatever I want to get into the locker room area. And then I'm going to change into the scrubs that are provided by the hospital before I enter the OR environment. So once I get to work and get changed and put on my scrub cap and then also my mask, then I can enter the operating room area. And by this time, I will have checked my assignment, see what kind of cases that I have for the day. According to that, I will go into the room that I'm assigned. I will set up the room according to the procedure. If we're doing like a gynecology case, we'll usually need stirrups that are going to position the patient's legs out. So I will go get the stirrups, put them onto the sides of the OR bed, and just get everything in the room prepared for that surgery. And then of course I will research the patient. So I will look up the patient chart, just get a general idea of their health, get a general idea of the procedure that they're getting performed, why they're having it done, just any comorbidities that they might have, any past medical history. Of course, the main things like their age, their height, all of these things are going to give me a good idea of the patient. Of course, it's just great practice to have a good general idea of the patient that you're going to go see and the patient that you're going to be taking care of. You want to have a good history of the patient and just really have a good backstory on what happened to them, why are they having this surgery, etc. All of that does play a big role in helping you empathize with the patient and helping you take care of them in the operating room. So a person that you're going to work very close with in the operating room as an operating room nurse is your scrub tech in the room. So just to give you an idea, the main people that are in the operating room, at least in the operating area where I work, of course they're going to be you, the circulating nurse, and then you're also going to have your scrub tech. So like I said, these are the ones that are scrubbed in with the surgeon. And then you're also going to have your anesthesia person. That is going to be the person who is responsible for putting the patient to sleep and making sure that all of their vital signs and everything is stable throughout the entire surgery. And then of course also your surgeon, and sometimes your surgeon will have an assistant with them, and sometimes they can also have a surgeon resident, which is a person who is training to become a surgeon. So depending on the type of surgery, of course, will depend on how many people are in the room. If you do a lot of orthopedic cases, there's usually a lot of sales representatives in there. So they're the people that are bringing in like all of the hardware. Like say you're getting a total knee replacement, the sales representative is going to be the person that is bringing in those pieces of equipment that are going to go into the human body. Like I said, depending on the type of surgery, it's going to depend on how many people are actually in the operating room during these surgeries. So a big part of setting up the room as well is of course helping the scrub tech. So the scrub tech is going to open the sterile field. They're going to do their sterile hand hygiene. They're going to put on a sterile gown, and we will just help tie them up and make sure if they need any extra supplies while they're opening their sterile field, we can help to open it sterilely onto their sterile environment, or we can just open the package to them without touching the inside. Then the scrub tech with their sterile gloves on and their sterile gown will grab the sterile supply from the package just to make sure everything stays sterile in the environment. So once we have the room set up and the scrub tech has opened their sterile field, scrub tech and I will count the sterile supply. So the scrub tech in front of me will count what we call lap, ray tech, and then also they will count blades, they will count sutures, they will count any piece of supply that could possibly get lost inside of a patient, and we will keep a note of the amount of supplies that we have on our sterile field. We will do this before the patient has even gotten into the operating room. And then of course during the procedure and after the procedure, we will recount these supplies, and this is just to help ensure that nothing gets lost inside of the patient. As you can imagine, something getting lost inside of a patient is a pretty scary thing to think. So this is one of our major responsibilities in the operating room. So it's a two-person job between the circulating nurse and the scrub tech to make sure we are keeping track of the sterile supplies during the surgery. How many sutures do we have? How many blades do we have? How many laps do we have? How many raise techs do we have? This is one of our main roles. It doesn't just fall on one person. It doesn't just fall on the circulating nurse if something were to happen, or the scrub tech. It's really a responsibility that the nurse and the scrub tech share together to make sure that all of the equipment is accounted for during, before, and after the surgery. So now we have the room set up, we've counted the sterile supplies, everything is ready to go. I've researched the patient. Now it is time to go to the pre-operative area, which is right outside of the operating room area, and it's time to go interview the patient. So during this interview, we're just asking you a lot of the questions that you've already been asked. So your name, your date of birth, do you have any allergies? Of course, what procedure are you having done? And then of course, if there's any specific side, we want to make sure we have all of that clarified before we take you back to the operating room. So the pre-operative nurse will have already asked the patient these questions before the OR nurse asks them again. So the reason why you're getting asked these questions multiple times, we really want to eliminate the chance that a wrong side of the body was operated on or a different procedure was performed, because as you know, surgeons are very busy. It could possibly happen where they think they're working on a different patient, so your nurses are going to be one of the last lines of defense to make sure that we have the right person in front of us and we're doing the right surgery on the right side of the body. And if you guys really want me to get into super in-depth detail on any of the things that I talk about in this video, just let me know. But this video is more of like a general idea of what an operating room nurse does. And then of course, like I said, if there's any specifics that you guys want me to go into more detail, just let me know in the comments and I'll be happy to make a separate video on the specifics that you're interested in. So a few of the other questions that we'll ask, aside from your name, your date of birth, and your allergies, and of course the surgery you're having done, we'll also ask when was the last time that you had anything to eat or drink. So this is very important to prevent aspiration during intubation of the surgery. So it's very important not to eat or drink anything several hours before you have had your surgery. Another question that we may ask is, do you have any metal implants anywhere in your body? Do you have any metal rods in you? Do you have any knee replacements, ankle replacements, any type of metal device inside of your body? And then of course, we'll just get a brief idea of who do you have there with you? Do you have any family? Is it okay to share any information with your family? Is it okay to give updates? And then of course, we'll ask if you, the patient, have any further questions that we can clarify for you or we can get clarified for you. So once the patient has been fully prepared in the preoperative area, they've been talked to by the pre-op nurse, they've been talked to by the anesthesiologist, they've been talked to by the surgeon, they've been talked to by the circulating nurse. Once everything has been squared away, and we have also made sure that all of the documentation matches up to the procedure we're having done and the patient that we're working on. Once everything is clarified and we're ready to go back to the operating room, then the circulating nurse and also the anesthesiologist or the CRNA will take you back to the operating room. So the CRNA or the anesthesiologist will usually be at the head of the bed of your stretcher, and then the circulating nurse will usually be at the foot of your bed, and then we will wheel you back into the operating room sterile environment. So once we get back to the operating room, we will take you right up next to the OR bed, and we will make sure everything is nice and locked and you are level with the OR bed, and then we will ask you to slide over to the operating room bed. By this time, the CRNA would have possibly given you some kind of a medication to just help you relax. As you know, surgery is a very nerve-wracking experience. You're going to be put off to sleep. You're going to be fully out of control of your body. So of course, it would be logical for any patient to be nervous during this type of a procedure. So the CRNA will usually give you a little bit of medication before we take you back to the operating room just to help you relax. And the medication usually takes effect pretty quickly. By the time we get into the operating room and ask you to slide over to the operating room bed, the patient is usually pretty relaxed and pretty comfortable and compliant with just sliding over. And then we will make sure that you're nicely positioned and we will secure you safely to the table. Then it'll be time to position you for the surgery. Like I said, depending on the surgery, you'll be in a different type of a position, and we will usually do that once you are off to sleep. Sorry, I had to change positions. My leg was falling asleep. Once we have you positioned, we'll set up the sterile environment closer to you, closer to the patient. We will get everything ready for the surgeon to come in and start the procedure. So once everything is positioned and everything is set up for the surgeon, we will either call the surgeon into the room or they will be nearby and will know that it's time to come in. Once the surgeon is in the room, the circulating room nurse will do what is called a timeout. So a timeout is basically the very last line of defense to prevent any type of a miss for a surgery. So the timeout is going to clarify once more for the very last time for everyone in the room to know this is the right patient with the right date of birth. These are the allergies if they have any. This is the surgery that we're performing. These are the antibiotics that they have been given. Several other things are going to be clarified during this timeout. It's a time for anybody in the room to voice any concerns they have or to clarify if this is correct. Once a timeout has been performed by the circulating room nurse, then the surgeon is able to go ahead and start the procedure. Now that the procedure has started, I will usually try to just make sure that everything runs smoothly, make sure that there is no other supplies that we need to go grab for the surgeon, make sure that the surgery has started off smoothly, and then the circulating room nurse can start charting the procedure. So a circulating room nurse will be responsible for documenting all of the people that are in the room during the surgery and also the times that everything occurred. So what time did we enter the room? What time was timeout called? What time did we prep all the sterile equipment onto the patient? What time were the medications given? What time did the actual surgery start? So all of this information is very important for the circulating room nurse to chart in their documentation of this specific surgery. I would say during 99% of the surgeries, no matter how much we have set up and prepared for the surgery, there's usually something that the circulating room nurse will have to go grab for the surgeon. Luckily in the ORs, they have what is called a sterile core. So a sterile core is a room within the operating area that is going to be centralized around your OR rooms. It's going to have a lot more of the supplies that might be needed during the surgery. So the circulating room nurse can go into the core, which is very close to the operating room, and just get any of those additional supplies that weren't sure that we needed or that we just couldn't have known before the surgeon actually entered the body cavity. So we will just be grabbing things like different sutures or maybe some drains or just different types of equipment. So of course during the surgery, like I mentioned, we're going to be making sure we have all of our equipment accounted for during and after the surgery. And then once the actual surgery has ended, the circulating room nurse will be responsible for getting the patient from the OR bed back onto the stretcher, getting the patient nice and cleaned up, and then taken to the PACU or post anesthesia care unit, where the PACU nurse will be responsible for taking care of the patient after the surgery. So in the perioperative environment, we have your pre-op nurse getting the patient ready for the surgery, and then you have the OR nurse or the circulating nurse, which is responsible for the patient during the surgery, and then you have the PACU nurse, which is going to be responsible for taking care of the patient after the surgery. So the OR nurse will then take the patient to the recovery area with the CRNA or the anesthesiologist, and we will give report to the PACU nurse or the post anesthesia care unit nurse. We just let them know a brief history of the patient, what surgery was performed, what medications were given, what antibiotics were given, anything that might have occurred out of the ordinary during the surgery. Do they have any type of drains added on them? What kind of dressings do they have after the surgery? So we're just going to give them a report of basically what happened during the surgery, anything that they would need to know. And once we have handed you over to the PACU nurse, then we can go back into our operating room area, and then we can help kind of just clean up all of the equipment, and then we could of course finish our charting, any documentation that we need to catch up on that we weren't able to finish during the surgery. And once we have done that, we will basically just do the same thing all over again with the next surgery. Depending on what hospital you work at, you may be in a specific specialty, so you may only do orthopedic cases all day, or you may only do urology cases all day, GYN cases all day, spine cases all day, neuro cases all day. But the hospital that I work at, we actually do a little bit of each surgery, so we're definitely well-rounded on the different types of surgeries that happen. So we will do anything from taking out an appendix, which is pretty quick minor surgery, to actually a total knee replacement, which as you can imagine is a lot more involved of a surgery. So depending on what hospital you work at, you may stick to just one specific specialty, or you may do a little bit of all of the surgeries. So definitely in your interview phase, when you are interviewing for an operating room nurse, make sure to ask if you will be potted into a specialty or if you'll be circulating different types of surgery. All right, you guys, so while I didn't cover every specific detail of a circulating room nurse, I hope this did give you a general idea of what a circulating room nurse will do in the operating room. Of course, if you want to know a little bit more detail about specifics of operating room nurses, definitely ask me in the comments below and I'll be happy to make a separate video on the topic. But yeah, hopefully you guys enjoyed this video. Make sure to subscribe and check out my other videos, and I will see you in the next one. Bye guys!